Welcome again to GPH 714. Each module consists of at least one lecture. This lecture will be concise and highlight key concepts, modules, terms, frameworks, etc. The readings and the research that you do for your assignments will build on those concepts and lectures, and you will explore the issues in more detail. Many modules will have a second lecture. This lecture will provide insight into the learning objectives as they are applied in the real world and public health profession. Let us begin at the beginning. Defining health. The World Health Organization, or the WHO, defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This definition was updated in the 1990s to include emotional and social well-being. Previous to this definition, definitions of health focused on clearly being disease-free, getting medical care. But as we gained better insight into people's, communities, cultures' perspectives on health, the definition evolved to what we have today. If you ask people to define health, many people will define health as getting enough sleep, financial insecurity or security, happy children, elderly who can thrive at their homes as long as possible, clean water, etc. So taking all those perspectives into consideration, the World Health Organization definition was updated. The WHO definition looks at health from an individual level. In public health, we take a much bigger view of health in terms of community and population health. Therefore, the definition of population health includes the idea around prevention of disease, around promoting health, and prolonging life. And what really makes public health and different just from general health is that we look at health from a community level and the health of our community. We know that the health of our community is reflective on individuals' health. We look at the social determinants of health. Those are things that affect our health besides our individual behavior choices. We are advocates for health equity. And we look at health and responding to health needs and concerns and strengths in a systems approach. All these terms and concepts you will be seeing and becoming familiar with through the course of this program. As part of your assignments this week, you're required to watch the This is Public Health video. This is a great illustration of what we do in public health. And as part of the discussion board this week, you are asked the question, where would you put your red sticker today? I look forward to seeing how you respond. Public health has had a history as long as woman and mankind. Public health's timeline includes great advances, controversial interventions, and many lessons learned along the way. Your readings this week will introduce you to major events and people. I provide this slide as not only one of humor, but also examples of how throughout history, public health has had to stay well aware of the current and emerging issues in our community. Whether it is providing guidance on burying people who died of cholera, to providing evidence-based information on the risk of cigarette smoking, our role in public health is to continuously monitor our communities and respond in culturally appropriate ways. In 1900, the average life expectancy of Americans was 46 years old for males and 47 for females. 100 years later, in 2000, it increased to 74 years old for males and 80 years old for females. Much of this is due to public health's role in improving the health of our communities. When we look back at the 100 years between 1900 and 2000, we reflect on 10 of public health's accomplishments in the United States. The first one is vaccination. We have seen substantial declines in hospitalizations, deaths, and economic burden with vaccine-preventable diseases. The smallpox vaccine made it possible to completely eradicate a disease, and we could potentially see the same with polio. According to the CDC, a recent economic analysis indicated that vaccination of each U.S. birth cohort with the current childhood immunization schedule prevents approximately 42,000 deaths and 20 million cases of disease, with a net savings of nearly $14 billion in direct costs and $69 billion in total societal costs. The next accomplishment is motor vehicle safety. Again, according to the CDC, motor vehicle crashes are among the top 10 causes of death for U.S. residents of all ages, and actually the leading cause of death for persons aged 5 to 34 years old. And this actually ranks third in 2007 behind only cancer and heart disease. And it accounts for an estimated $99 billion in medical and lost work costs annually. From 2000 to 2009, while the number of vehicle miles traveled on the nation's roads actually increased by almost 9%, the death rate related to motor vehicle travel declined from about 15 per 100,000 population to 11. And the injury rate declined from about 1,130 to 722. Among children, the number of pedestrian deaths declined by 49%, from about 475 to 244, and the number of bicyclist deaths declined by 58%. These successes largely resulted from safer vehicles, your airbags, better seatbelts, safer roadways, and safer road use. Behavior was improved by protective policies, including effective seatbelt usage and child safety seat legislation. In addition, graduated drivers' licensing policies for teen drivers have helped reduce the number of teen crash deaths. The third accomplishment is work safety. Things like child labor laws and the creation of OSHA have assisted in safer workplaces. In 1980, safer workplaces have resulted in a reduction of approximately 40% in the rate of fatal occupational injuries. Estimated cost of these fatalities equals about $147 billion annually for medical care, lost wages, and lost productivity. The fourth accomplishment is control of infectious diseases. This is one area in public health where we see significant disparities between the United States and other parts of the world, which are plagued by infectious diseases that we consider a rarity in the United States. Strides in sanitation, hygiene, healthcare, infection control, accurate education, and infectious disease prevention and control have contributed to reductions in the incidence of infectious diseases. The fifth accomplishment is the decline in deaths from coronary heart disease and stroke. This has resulted from risk factor modification, especially around diet and exercise, in addition to smoking cessation, blood pressure control, coupled with improved access to early detection and better treatment. Since 1972, death rates for coronary heart disease have decreased by 51%. The seventh accomplishment, safer food handling, safer and healthier foods. Through food handler education, mandatory restaurant inspections, food manufacturer inspections, farm collective inspections, food embargoes, and rodent vermin control, we have made great strides in safer and healthier foods. The seventh accomplishment, healthier mothers and babies. Since 1900, infant mortality has decreased by 90% and maternal mortality by 99%. In addition, in the past decade, we have seen dramatic decreases in teenage births. This is a health concern linked to lifelong poverty. Advances in technology, greater access to care, availability of antibiotics, etc., contribute to this achievement. Though looking at data across the world, we still have a long way to go within the global context. Also related is the eighth achievement, family planning. The hallmark of family planning in the United States has been the ability to achieve desired birth spacing and family size. Fertility decreased as couples choose to have fewer children. Concurrently, child mortality declined and the age at marriage increased. The ninth achievement, which has been laced with some controversy, is the fluoridation of drinking water. By 1999, fluoridation reached an estimated 144 million persons in the United States, and these are mostly people who are linked with municipality water. Fluoridation has played an important role in the reductions of tooth decay by as much as 40 to 70% in children, and the loss of teeth in adults between about 40 to 60%. And our last accomplishment listed is the recognition of tobacco as a health hazard. Since publication of the first Surgeon General's report on tobacco in 1964, implementation of evidence-based policies and interventions by federal, state, and local public health authorities has reduced tobacco use significantly. By 2009, almost 21% of adults and almost 20% of youths were current smokers, compared with almost 24% of adults and 35% of youths 10 years earlier. However, progress in reducing smoking rates among youth and adults have appeared to stall in recent years. And although no state has had a comprehensive smoke-free law in 2000, the number increased to 25 states and the District of Columbia by 2010. The three core functions of public health and the 10 essential public health services describe public health in action. They answer the question, what does public health actually do? As I review the core functions and the essential services, I will use public health's response to influenza as an example of how the essential services are applied. The first essential service, monitor. This is monitoring the health status to identify community health problems. As it relates to influenza, this includes collecting data on hospitalizations, deaths, outbreaks to determine who is most affected, how they're most affected, and how it impacts the community. Our second service, diagnose and investigate health problems and health hazards in the community. Laboratories play a significant role in the example of influenza. Laboratories confirm influenza and conduct testing to subtype them. Do we have a current strain? Do we have a novel strain? The third service, inform, educate, and empower people about health issues. This can include commercials, posters, campaigns on influenza prevention. You are probably all familiar with the Cover Your Cough campaign. The fourth essential service, mobilize community partnerships to identify and solve health problems. For planning, implementation, and response to seasonal influenza surveillance, prevention, control, public health depends on its partnerships. Therefore, public health plays a leadership role in bringing together partners like emergency management agencies, schools, healthcare, businesses, to form a collaborative approach to influenza. The fifth service, develop policies and plans that support individual and community efforts. During influenza, important for schools and workplaces have been policies on staying home when sick. The sixth service, enforce laws and regulations that protect health and ensure safety. Many hospitals enforce their vaccination with influenza vaccine of healthcare workers. Their policy may include that healthcare workers either get immunized, wear masks, or terminate their employment. The seventh service, link people to needed personal health services and assure the provision of health care when otherwise unavailable. While public health's role is not to provide direct medical care, It has a role in ensuring access, particularly for those populations that experience health disparities and obstacles to access. In the case of influenza, community vaccination clinics are a good example of this service. The eighth service, assure a competent public health and personal health care workforce. An essential ingredient to a quality public health system and delivery is a well-trained, competent workforce. For example, during H1N1, pharmacists became trained to provide vaccines. Public health not only focuses on a competent public health professional workforce, but also targets clinicians, mental health professionals, law enforcement, etc., to be a part of the competent public health workforce. Number 9, evaluate effectiveness, accessibility, and quality of personal and population-based health services and interventions. Ensuring what we are doing works and what doesn't work, and make changes. We do this each year when we look back at the influenza season and reflect on what has been effective and what has not been effective. Formally, we sometimes call these debriefing sessions. And the last essential service is research. Research for new insights and innovative solutions to health problems. Public health research is involved in community-based research. For influenza, this could be researching new vaccines, new ways of delivering vaccines, new prevention interventions, etc. Public health is organized around 5 core discipline areas. These areas will become quite familiar to you as the core and required courses for University of New England's MPH program are based on these 5 core knowledge areas. And they include biostatistics, epidemiology, environmental health, social and behavioral health, and health services administration or health policy and management. Biostatistics is the collection, storage, retrieval, analysis, and interpretation of health data. It is the design and analysis of health-related surveys and experiments, and concepts and practice of statistical data analysis. Epidemiology, which comes from the Greek meaning upon the people, is the study of disease upon the community. It looks at the distributions and determinants of disease, disability, and death in human populations. It explores the characteristics and dynamics of human populations, and also studies the natural history of disease and the biological basis of health. Environmental health sciences focuses on environmental factors, including biological, physical, and chemical, that affect the health of our community. Social and behavioral health includes concepts and methods of social and behavioral sciences relevant to the identification and solution of public health problems. It is exploring issues beyond individual behaviors. And health services administration, which also includes health policy management, is the planning, organization, administration, management, evaluation, and policy analysis of health and public health programs. It also includes policy making and public health law. So in conclusion of today's lecture, I find Helen Keller's quote very applicable to how we approach public health. The welfare of each is bound up in the welfare of all. Thank you.